answer a common question we receive, and that's what's the difference between what you do as neurostructural chiropractors and what conventional chiropractors in the area do. Many of the answers have to do with what happens in this room, the examination room. At Keystone Chiropractic, we test and don't guess with your health. Here we use a number of objective tools to determine the presence of structural shifts or abnormalities in a patient's spine, which may be contributing to secondary conditions or symptoms they're experiencing. One of the unique aspects of our examination process is that not only are we, as doctors, able to see if and where a problem exists, but after some education, the patient can clearly see the problem as well. The examination also allows us to make precise measurements and compare results before and after the correction phase of care. The examination process includes 4 parts. First, we perform digital structural radiographs, which give us a clear and almost instantaneous picture of a patient's spine. We take pictures of the cervical spine, thoracic spine, and lumbar spine and pelvis to obtain an accurate assessment of the current state of someone's structure. It's a blueprint to restoring the spine back toward its normal position. Software allows us to perform very specific analysis on the radiographs to determine the severity of any structural shifts in a patient's spine and create the best plan of care for them. Next, digital photographic structural evaluation and the 3-dimensional structural analysis are used to determine a patient's structural integrity. These tools allow us to evaluate discrepancies in the level of the shoulders and hips, whether the head is tilted or rotated one way, and how weight is distributed from side to side as a result of structural abnormalities of a patient's inner frame. Lastly, our Thermographic NeuroStructural Assessment provides us with information detailing where the nervous system is being affected most by structural shifts of the spine. This device is run along the entire length of a patient's back, and a thermographic or heat reading assists us in pinpointing exactly where we need to focus our care. The examination process is essential to a patient receiving the best corrective care possible. It allows both doctor and patient to see there are indeed structural shifts contributing to secondary conditions and produces objective results which can be compared before and after a patient goes through care. It is one of the biggest differences between neurostructural care at Keystone Chiropractic and conventional care throughout the area. We test and don't guess with your health. Thank you for tuning in to today's blogcast and for taking the time to learn a little bit more about Keystone Chiropractic.